You are live with me, Barry Musa, on the Africa Daily Show on Africa Global Radio, and I am here to serve you all the way to 3 p.m. GMT. Now, the show comes off Monday to Friday, 1 p.m. to 3 p.m. GMT on Africa Global Radio Network. You can listen to the show live Monday to Friday on africaglobalradio.com, or you can have the aftermath on demand, africaglobalradio.com, or have the segments on Facebook, Africa Global Radio. Subscribe to our YouTube channel, Africa Global Radio. Let's get on now to get some updates in the COVID-19 space. Stay with us.
COVID-19 Diaries. COVID-19 Diaries.
COVID-19 Diaries.
Today is Tuesday, the 2nd day of February 2021. The world has recorded a total number of 103,967,575. 75,812,441 have recovered from the virus globally. 2,248,796 have died, unfortunately, from the virus. Condolences to all bereaved families out there. Not a good space, one would want to find themselves. God knows best, as every believer would say. We have the opportunity, we have the chance to also protect ourselves, because if we've actually witnessed such an event happen on a loved one, people we care about, people we love so much, it means that we're also potential victims of some of these things. So please, let's be very safe and protect ourselves very, very well. Let's see what the figures are saying on the continent of Africa.
COVID-19 Africa. COVID-19 Africa. Daily updates.
Today, the 2nd of February 2021, Africa has recorded 3,598,945 coronavirus cases. 3,085,758 have recovered from the virus on the continent of Africa. 91,588 have died in Africa from COVID-19. I say sorry, like the Yoruba would say, Pele. Yeah, emasu, don't cry. Yeah, it's difficult sometimes. But sometimes you need to let the tears flow, because it eases you a bit. But it would never, mend or replace that scar, or more of like take it off from the pain, But we can prevent future occurrences from happening if we adhere and take this whole thing, adherence to safety protocols, very, very serious, because it is actually on the rise. And I would say that there's a lot of work that has to be done in that regard. There's a lot. Well, let's move on to South Africa, and that is the epicenter of COVID-19 on the continent of Africa. Now, South Africa has recorded 1,456,309 cases. 44,399 people have died, making South Africa the highest recorder of fatalities on the continent. Now, talking about South Africa, now they have actually, received the first batch of coronavirus vaccine. And the first 1 million shots of the Oxford-AstraZeneca vaccine will be used to inoculate healthcare workers amid surge in infections. And when we talk about South Africa, we shouldn't also forget about the new variant that is actually spreading fast and causing infections even at a larger margin. So it's not looking good. Numbers are going up. Numbers of fatalities are going up. And but then, efforts are being made to get the vaccine and so far has the first barge has arrived in South Africa. Yeah, so we're waiting to see what happens moving forward. If the situation would minimize, if it would bring about a decrease or a control in the spread generally. But I think the individual citizens in South Africa really need to be, on the high alert. That's the most important thing, because the communication, the talks, and the education, everything would amount to nothing if people are still practicing their old ways of doing things. You need to change, because the world is no longer the same as it used to be some 2 years back, I believe. Okay, and in our base Ghana, there's a new development as well, which I think we really need to take very serious. Now, there was a press release yesterday. The Food and Drugs Authority approves first herbal medicine for clinical trial on COVID-19 treatment. Now, the Foods and Drug Authority, FDA, the National Medicine Regulatory Agency in Ghana, has approved a herbal medicine. Okay, now the name, I need to take my time. It says Cryptolepsis sanguinolenta, locally known as Nibima, for clinical trials. And this happened last month. So, in a search for a treatment for the ongoing COVID-19 pandemic, researchers from the School of Public Health at the Kwame Nkrumah University of Science and Technology in Albais, Ghana, in Kumasi, submitted a clinical trial application in September 2020 to assess the safety and efficacy of, let me pronounce the locally name they pronounce, that's Nibima. Efficacy of Nibima as a potential treatment for COVID-19. Now, this follows results from laboratory studies conducted by the KNUST research team, with points in the direction, which points in the direction of possible clinical benefits. Now, the FDA Ghana is listed as a World Health Organization Maturity Level 3 regulatory agency, the second country in the World Health Organization African region to attain this level in the 4-tier World Health Organization classification of natural medicines regulatory systems. Okay, this is a herbal one. It's actually good. At least at least we're headed somewhere in our base Ghana. But I still think the World Health Organization should also take another look at the COVID organics in Madagascar. I mean, if this is herbal, yeah, obviously. The last time we spoke about it with the head of Noguchi, said it has to go through certain, measures and systems and everything. If that has to be done, that should be done. Okay, so I mean, we will know where we're going. Some people still don't believe COVID-19 is real. That's one. Some actually don't want to hear about the vaccine because they are not willing to take the vaccine. Are we going or we're coming? So yeah, this is good development from our base Ghana. First batch of vaccine at Oxford-AstraZeneca arrives in South Africa. Let's see what the future gives birth to.